My name is Dr Ewan McKay. I'm a consultant cardiologist, and my NHS practice is based at the Royal Liverpool Hospital, and I also offer private services at the Nuffield Hospital in Chester. I wanted to be a doctor because at school, classically, I was pretty reasonable at things like science, mathematics. These come quite naturally to me. I enjoyed them, and so then I thought, well, how do I get a job? What am I going to do with myself? But actually what I really enjoyed doing was working with people. And so I tried to put the two things I enjoyed together most, and it was recommended to me that maybe I should go for medicine. And it worked out perfectly for me. Once I got into medical school and started my studies, the things that I enjoyed most and the people that I was inspired by most happened to be cardiologists. And so as I took that down the natural path and ended up becoming a cardiologist in the end. And I'm really pleased that I made that choice. Every day I go to work enjoying seeing my patients, trying to help them as best I can, and generally leave with a smile. So yeah, really pleased how it worked out. So for me, as a person, I really enjoy just making sure I've got the details of what's wrong with the person correct. I like to know that what's wrong with them, because we talk about conditions all the time, things like angina or chest pain or breathlessness, but anyone can have those things, but it's really how it affects that person, what changes their day-to-day, how it influences things that they either can or cannot do, that when I can then try and use my approach to try and help figure out how to help them best, that I really just find that's such an amazing thing to be able to do for somebody. So yeah, I would say that's generally for me the best bit of everything that I get to do every day. I think that what they value most about me is also probably what I think I'm best known for. I think it goes back to my previous answer a little bit as well, in that everyone's such an individual. You know, there's so many things that can happen, but it's how it affects their life, and it's understanding not only the medicine, how to offer therapies, how to offer treatments that might improve their symptoms, life expectancy, but it's about understanding that impact upon their quality of life, understanding about how you might be able to improve the perhaps the other parts of the condition as well, the psychology, the stress, the anxiety. And I think one of the phrases I use most when speaking to patients in consultations is that it's a team sport. It's not just about how it affects the person. It's about how it affects maybe their wife, their husband, their family. They worry more than the patients often do, and so we have to be there to try and support them through these sometimes very difficult times. And when that's done well, often patients do improve. They do get better symptoms. They have better functionality. They've got a better quality of life overall. And even when perhaps things can't be fixed, they can often be made better. And I think people recognize that's something that I do take the time to do, and it's something I pride myself on.